Welcome to the Total Weight Loss Center's informational seminar on bariatric surgery. I'm Dr. Keenan Berghoff, the Medical Director of the Total Weight Loss Center. I am a board-certified general surgeon with fellowship training in advanced laparoscopic surgery and bariatric procedures.
And I'm Dr. Josh Moreau. I'm also a board-certified surgeon with fellowship training in advanced laparoscopic and bariatric procedures. Fellowship training means that after we finished our general surgery training, Dr. Berghoff and I each completed one-year programs that focused exclusively on bariatric surgery.
We are glad you chose to spend some time getting to know us and learning more about our surgical weight loss program. Weight loss surgery is a life-changing decision. Attending this seminar is an important first step because understanding what happens before, during, and after surgery will help you make the best decision for your health. This video provides an overview of our program. If you decide to move forward with bariatric surgery at the Total Weight Loss Center, we'll meet with you one-on-one to discuss your specific goals and program details.
Our program takes a multidisciplinary team approach to your care. Your care team includes a medical weight loss physician, registered nurses, registered dietitians, patient care technicians, a psychologist, nurse practitioners, a program coordinator, and insurance coordinators.
Our entire team works with you and supports you every step of the way so you can achieve your weight loss goals.
When considering bariatric surgery, it's important to have a basic understanding of obesity. Everyone has an ideal body weight based on their gender and height. A person is considered obese when they weigh more than their ideal body weight. Body mass index is one tool we use to calculate overall body fat. This information helps us determine if you are a good candidate for bariatric surgery. If your body mass index, or BMI, is below 18.5, you are considered underweight. If your BMI is between 18.5 and 24.9, you are considered to be of normal weight. A person who is overweight has a BMI between 25 and 29, and the BMI of a person with obesity is 30 or higher.
In most cases, to be considered for bariatric surgery, you should have a BMI of 35 or greater, not have any medical conditions that could make surgery risky, be willing to engage in lifestyle and diet changes that support weight loss, and have the support of your family, spouse, or close friends. You may qualify for surgery with a lesser weight if you have serious health issues that could also improve with significant weight loss.
Many factors contribute to obesity. It's important to understand and address how those factors affect you before moving forward with surgery. The most common causes of obesity are food consumption, a sedentary lifestyle, genetics, and behavioral factors such as anxiety and depression.
When you are overweight, unfortunately, you're at an increased risk for developing serious and often life-threatening health issues. Obesity-related problems include diabetes, heart disease, high blood pressure, high cholesterol, increased risk of certain cancers, obstructive sleep apnea, liver disease, pulmonary disease, gallbladder disease, gout, and even stroke. When you successfully lose weight through surgery or another method, many of these health issues can improve or go away completely.
The stomach produces hormones that control your hunger. We call these hunger hormones. When you are hungry, hunger hormone levels rise in your bloodstream and signal the brain that it's time to eat. After you eat, these hormone levels drop and you feel full. In obesity, however, hunger hormones don't go up and down like they're supposed to. Instead, they hover at different levels. When we operate on the stomach, however, this hunger disorder corrects itself. Other physiologic changes also take place that cause you to lose weight, and several months after your surgery, you will likely realize your cravings and how you think about food have changed. In fact, your cravings tend to be more towards healthy foods, which help you stay full longer.
We look at obesity as a disease and surgery as a medical treatment for this disease. In fact, we call it metabolic surgery. Every person we see in the Total Weight Loss Center has already tried nearly every other weight loss option out there. Although bariatric surgery is an invasive approach to weight loss, it is very safe and is the most successful approach in the long term. At the Total Weight Loss Center, we have many surgical options available for treating obesity. These options include the sleeve gastrectomy, the gastric bypass, and the modified duodenal switch procedure.
A sleeve gastrectomy is a minimally invasive procedure where we use small incisions to remove about 80% of the stomach. This creates a smaller banana or sleeve-shaped stomach that holds significantly less food. Because you eat less food, you feel full quicker and are able to lose weight. With a sleeve gastrectomy, surgery lasts about an hour. The surgeon makes several small incisions and uses a stapler to create the smaller stomach. The stomach is then removed from the body, so this procedure is permanent and cannot be reversed. Patients should expect to stay in the hospital overnight following surgery.
Like the sleeve gastrectomy, gastric bypass is a minimally invasive procedure. It involves making a new, smaller gastric pouch, which allows you to get full on fewer calories and allows you to absorb less of those calories. As a result, you lose weight. Gastric bypass is a reversible procedure that lasts about an hour and is done through several small incisions. An overnight hospital stay is required.
The modified duodenal switch is another minimally invasive procedure we perform that combines aspects of a sleeve gastrectomy and a gastric bypass. In the modified duodenal switch, the surgeon bypasses a portion of the small intestine and reduces the size of your stomach. Surgery lasts about an hour and involves the surgeon making several small incisions to perform the procedure. Following surgery, patients should expect to stay in the hospital overnight.
You will lose a fair amount of weight in the first 3 months. The farther out you are from surgery, the slower your weight loss becomes. That's because your body adjusts over time. About a year after surgery, your body has adjusted to the point where you move from weight loss to weight maintenance. Soon after surgery, if you follow the recommended diet, you begin to enjoy many health-related benefits and an improved quality of life. In fact, more than 80% of the time, diabetes resolves. 75% of high blood pressure cases go away. 70% of elevated cholesterol levels normalize, and 90% of weight loss is maintained beyond 10 years.
While no surgery is risk-free, minimally invasive bariatric surgery is as safe as routine surgeries like a hysterectomy or gallbladder removal. Surgical risks include bleeding or leaking from the surgical site, wound infection, pneumonia, and urinary tract infections. Other minor complications are also possible. While the mortality rate for bariatric surgery is not zero, it is extremely low and occurs in less than 1 in 1,000 cases. In reality, remaining obese poses a significantly higher health risk to a person than the risks associated with bariatric surgery.
If you decide to explore surgery further, the first step is to have one of our insurance coordinators verify your insurance coverage and requirements. Once we have verified your insurance, we will schedule your first clinic appointment. At your first appointment, you'll meet with one of our surgeons, a nurse, a dietitian, and an insurance coordinator. We'll review your medical history, including current medications, and conduct a physical exam. We'll also discuss the different procedures and which surgery might be right for you. At your first appointment, we will also provide you with a comprehensive patient guide to use throughout your journey. If you have underlying health conditions, we'll work with your primary care physician, cardiologist, pulmonologist, or other medical specialists to help you get ready for surgery. As you get closer to your surgery date, you'll meet with our psychologist if you don't already see one. They will help you develop new strategies for managing food cravings and stressful situations so you can continue losing weight.
I'm Cricket, one of the Total Weight Loss Center's insurance coordinators. It is my job to work with your insurance company to determine your eligibility requirements. Because we want you to focus on the surgery, we obtain any approvals necessary and keep you informed along the way. If your insurance company does not cover bariatric surgery, we offer finance options for people who would like to pay out of pocket.
My name is Jackie. I'm one of the 3 registered dietitians on the Total Weight Loss Center team. You will meet with a dietitian many times before, during, and after your surgery. We're with you every step of the way and are always ready to answer questions and provide support. As you learn about how your food intake will change after surgery, you may find it hard to believe that eating a small amount of food can keep you healthy, satisfy your hunger, and make you feel full. We understand how difficult it may be to change the eating habits you've built for many years. We're here to help you make that transition.
My name is Cami. I am a registered dietitian on the Total Weight Loss Center team. You will be on a high-protein, all-liquid diet for about 5 days before surgery. This helps you lose weight and reduces the size of your liver. This makes surgery technically easier and ensures you have the safest and most successful surgery possible. In general, a liquid diet includes protein drinks, clear broth, coffee, milk, sugar-free gelatin, sugar-free non-carbonated beverages, sugar-free popsicles, tea, and water.
My name is Becky. I'm a registered dietitian on the Total Weight Loss Center team. You will continue with the high-protein, all-liquid diet for the first week after surgery. Over the next several weeks, you will continually add new foods until you are eating regular food, just in smaller portions. It takes about 7 weeks to move from a liquid diet to a more regular diet. During that time, you will also begin taking a bariatric multivitamin and a calcium supplement. These are required lifelong after weight loss surgery. Changing your eating habits, reducing your food intake, and following the new diet requires a commitment. We are always available to answer questions and provide support, either over the phone, by email, or on our Facebook page.
While a new diet is a key part of your weight loss, regular exercise also plays a big role. Immediately after surgery, the amount of exercise you do will be minimal, but over time your activity level will increase because you'll have more energy and feel better overall. Simply walking can make a big impact. During your clinic visits, we will talk about exercising and provide guidelines, ideas, and all the support you need to keep moving. We offer several fitness resources, including an on-site affordable fitness center, wellness pool, and bariatric-specific exercise classes.
The first week after surgery, you may experience nausea, pain, or fatigue. As you add more foods to your diet and continue recovering from surgery, you begin to feel better. Follow-up appointments are an important part of our program. These visits help us make sure your recovery is going well. At each appointment, you meet with your surgeon and a dietitian to talk about how you're doing, what's working, and what will help you continue to meet your goals. There will be times that you get off track. That is normal and expected. But if you keep trying, come to your scheduled appointments, and participate in our support groups, you will do just fine. During the first year after surgery, we schedule follow-up appointments for 1 week, 6 weeks, 3 months, 6 months, 9 months, and 1 year. After the first year, we like to see you at least annually.
There are many options for surgical weight loss here in Kansas City. The Total Weight Loss Center is accredited through the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. This accreditation means our facility meets the highest standards for patient safety and quality of care. Our center is also a center of quality and excellence. We're different from other facilities because our program is staffed with fellowship-trained surgeons and offers a comprehensive experience. There's a full range of hospital services on site. We host online and in-person support groups, have an on-site fitness center, and provide a lifetime of follow-up care.
What protein supplements are best? There's so many options to choose from. Everyone has different taste. We recommend trying different brands, types, and flavors to see what you prefer. Protein drinks can be water-based, milk-based, thick, or thin. We provide you with recommendations.
How long will I be off work? Typically, you will need to take 1 to 2 weeks off of work.
Can I smoke and still have surgery? Your risks for complications during surgery go up if you use nicotine, so we want you to quit before surgery.
Will I have diarrhea after bariatric surgery? We don't see that a lot in our patients. In fact, the more common complaint is occasional constipation after surgery.
Will my insurance company require me to lose weight before I have surgery? Most insurance companies require people to visit us or their primary care provider monthly for a period of time before surgery. I will help you navigate any insurance requirements.
Regardless of where you decide to have surgery, one thing remains the same. Bariatric surgery is simply a tool for weight loss. It does change your physiology to help you lose weight, but the hard work is up to you. Unfortunately, many people don't pursue surgery because they are either afraid of the risks or they feel that having surgery is admitting to failure. Actually, avoiding surgery increases your risk of early death because of the ongoing obesity-related health issues. In fact, you are 10 times more likely to die from these health risks than from surgery alone.
Deciding to have weight loss surgery doesn't mean you failed or are giving up. It means you are making the choice to change your life for the better. You are choosing to not let life pass you by. Weight loss surgery isn't easy, and it will require a significant commitment, but it will be the best decision you make for your health. Combined with our support services, educational resources, and diet and exercise plans, you will meet your surgical weight loss goals.
One last piece of advice. Before making the decision to have weight loss surgery, we encourage you to talk with someone who has had bariatric surgery at the Total Weight Loss Center. We are confident they will strongly recommend our program. In fact, most people say they wish they would have come to see us years earlier. Thanks for spending time with us, and congratulations on taking this step in meeting the first pre-surgery requirement. We will reach out to you to schedule a clinic appointment, and we look forward to meeting you in person very soon.